Hello, everyone, and welcome to the US and EMEA segment of Intellect's Mental Health Festival 2025. We're so excited to have you all join us here today. I'm Aisha, the Deputy Brand Marketing Lead here at Intellect, and I'll be one of your MCs for today's festival. So we'll be giving it about a minute or two for people to join us. And so whilst we're waiting, I thought I'd take this opportunity to introduce Intellect for those who are joining us for the very first time. Intellect is a global mental health care company. We provide end-to-end mental health support in 120 languages to over 4 million people in more than 100 countries. Mental Health Festival is our flagship annual event, and we're proud to keep it free for all as part of our mission to make mental health care accessible, inclusive, and stigma-free. All right, I see that we have quite a lot of attendees in the room already. So without further ado, let's set the stage for what we'll be exploring together and kick off the US and EMEA segment of Mental Health Festival 2025.
Why is mental health important to me in my life?
Well, for me, mental health is really about how you turn up at any time of your day.
So it can affect your family, it can affect, your work.
To me, because I think it affects how I show up and the amount of headspace I have for those around me.
Not just about your bad days, it's also about your good days.
Is about overall well-being, emotionally steady, thinking clearly, maintaining positive relationship.
Knowing your mental health, it's important.
For me, I discovered Intellect after giving birth to my second child. So with Intellect, I actually do the daily check-ins to see how I feel for the day. I think it's a very small mindful step that I take every day now to really monitor and keep track of how I feel.
The platform has been very kind and very easy to access and easy to understand.
Mental health is not doing great, that's okay, and Intellect has been like an avenue where you can go and it can support you in all ways, and that in a way has also helped to enhance other areas of my life.
Because every conversation I have with my managers now is, look, get your staff member to engage with Intellect. They could whether it's a phone call, whether it's jumping onto the app, and so there's more conversation now.
But we have seen employees coming back and giving us feedback on improved mental situations. Stress levels have come down, and the team members really feel supported.
I'm Chinese. People here is not always openly talk about mental health.
Especially in Malaysia, in my culture, it's not so spoken about.
I believe that maybe because of Asian culture that we tend to keep everything to ourselves.
And I think we should be more open and accepting when we talk about it.
It really shouldn't be looked upon as a bad thing, but really more about, working on yourself and trying to be better at whatever it is you're doing and being better at life.
Mental health, like any other health situations, it is a shared responsibility. It is quite safe to speak about it openly, and we can talk about mental challenges more openly with anyone that you would like. With Intellect, we have that support available, and I would encourage everyone to use it, whoever is listening to this message.
Welcome everyone tuning in from the US, the Americas, Europe, the Middle East, and beyond. Thank you all for joining us, wherever you're based in, whatever time it is, amidst your busy schedules. My name is Theodoric. I'm the co-founder and CEO of Intellect, and it's first and foremost my utmost pleasure and honor to welcome all of you to join us for Mental Health Festival 2025. First and foremost, to kick off, this is our 5th ever edition of Mental Health Festival, and for the very first time, we're hosting a dedicated session and breakout tracks for our US and EMEA communities and attendees listening in. Over the past few days, we've heard from many voices across all industries, in person and online, all united by one clear mission: building what matters in mental health. And I'm very glad and excited that you're here today. Today, it's your turn. You are the finale of this global movement, the last word in our festival, and the perspective that completes the story of what we're trying to do. This festival isn't just about Intellect, this is about all of us, the leaders, the clinicians, the individuals who make mental health very real in all of your workplaces and communities, wherever you're at. So kicking off with the theme of this year's festival, for many of you guys that are newly meeting us or hearing about us, I'm very glad to introduce what Intellect is all about and who we are as well. So why are we all here today? This year's theme is building what matters. Here's what we know for a fact. Mental health cannot just be a perk. We've gone through the pandemic. We've seen the ways we were looking at mental health before the pandemic, during and after. And today itself, thankfully, we've made strong progress. Mental health today is no longer just a perk. It's no longer just a check the box program. It has to be, and it is seen as core infrastructure to anything that we do, from the workplace to our personal lives. And the key thing about infrastructure is this: it cannot be done by a single stakeholder, a single company, a single platform alone. It needs a whole ecosystem of stakeholders, partners, and movements to make sure that this actually works. Be it whether you're a HR leader, whether you're a clinician, whether you're an insurer, a government policymaker, or just an individual, wherever you're at. We all play a part. And importantly, with any infrastructure and system, this must be designed to last across geographies, markets, generations, and cultures. And that's why our theme of building what matters really, really matters. Because when we get this aspect right, we're not just only improving well-being, we're building a whole system and organization where people thrive and societies can be healthier and stronger. So for this year's festival, here's what you can expect a little bit about us. All right. So for HR leaders tuning in, you'll hear directly from peers in your industries and different industries in HR on how they navigate the complexities of scaling well-being in global organizations and workforces, the trade-offs that one has to make, the hidden challenges, and the strategies that win boardroom approval. For the partners, consultants, and brokers in the room, here's what you get to learn about. You'll gain further clarity on how global benefits can be designed with local precision, ensuring care is effective, relevant, and simple and easy to deliver, whether it's a small workforce or a very large one. And for everyone else, you all walk away with clear proof points and language on how you can actually use and support the stakeholders that you are covering, you're supporting or enabling in your workplaces or your societies. And of course, if you join us as an individual, not from an organization, a school, or any of that stakeholder we spoke about, if you're an individual that cares about mental health, you also get a unique behind-the-scenes look at how organizations are tackling these challenges around well-being and mental health. You'll see how the conversations in HR boardrooms and partner networks ultimately shape the care that reaches you, your colleagues, and your community. So thanks a lot for taking the time to be here. So for those who are joining us for the first time at Mental Health Festival, I want to spend just a minute introducing who we are at Intellect. So Intellect, first and foremost, we are a leading mental health care well-being solutions provider. We were founded out in Singapore, and over the last 6 years, we have grown exponentially to today become one of the world's largest and leading global mental health service providers. We have the honor and privilege of serving over 4 million lives worldwide, over 100 countries in 120 plus languages, and hundreds of workforces, organizations across the world. We are honored to be trusted by many of the world's largest Fortune 500 employers, governments, and insurers as their partner in care in supporting the people that have all found support using our platform. And Intellect, we don't just scale reach. We believe that care has to be trusted, has to be local, and importantly, clinically validated. So before we dive into today's festival and segment, I want to give a very quick recap of what we touched on last year at Mental Festival 2024. So a year ago, we spoke about a couple of key things. We highlighted how Intellect moved from a regional platform towards a global ecosystem, delivering care online all the way through to its offline in-person clinics and deployments as well. We expand our footprint exponentially, and today we've gone further beyond that. And importantly as well, we've gone beyond just delivering care into other key initiatives of engaging different stakeholders from the top down and bottoms up. We became a licensed provider for the Mental First Aid Accreditation Program, and we also doubled down on core aspects around our ecosystem of care, our best-in-class experience, and importantly, trusted clinical excellence. So with that, let me dive into what matters this year and what we're going to talk about as our core pillars before we kick off today's festival agenda. 3 key things really matter in what we're building at Intellect. The first key thing, as I briefly alluded to, is a global ecosystem of care. How can we scale care across the world, whether you're based in Sao Paulo, in Japan, in India, without compromising on the quality and human aspect anywhere where you're at? The second key thing is on building best-in-class experience. A core part of what has led Intellect to our growth, our success, and our ability to serve clients globally is really curating, designing a user experience from the ground up for mental health benefits, from the platform to the clinical experience to the matching and a lot more, that ensures that we take off the load of our clients, the HR teams we work with, and our partners. And the last thing on this slide that you see, a very key one that has been core and the bedrock of all that we do, is ensuring that there's leading clinical excellence and outcomes in all that we do. Since the very first day that we've begun our journey, we've always ensured that we embark on anything that we do with strong scientific evidence and clinical outcomes. And of course, last but not least, being a tech company, first and foremost, we cannot omit and miss out the fact that technology and AI is a multiplier of care. I say this with some caveats. Naturally, we know of all the good things that AI can do, but also all of the pitfalls and gaps that it has, being a very, very new and advancing technology. We believe at Intellect fundamentally that with the strongest foundations, we don't know exactly a lot of things that is out there, but we know for sure that mental health care supply is not enough today. We believe that demand is outpacing supply everywhere, and that's why using technology, using AI, we can help bridge and close that gap responsibly. When we talk about technology and AI, we don't believe in replacing humans, but importantly, enhancing and augmenting care through the support of these tools that we actually have developed. And you hear from my colleague, Dr. Oliver, later on how we're designing very, very strong clinical guardrails around developing AI for mental health care. But importantly, we've built AI on top of a strong clinical governance and frameworks, ensuring that there's safety and efficacy while enabling us to reach more people out there. So while we've been working on all these pillars, it won't mean anything for us to try and figure things out on our own. We believe, as I shared earlier, that all aspects of mental health care that we're bringing to life has to have different partners working together not in isolation. So that's a bit of who we are, the foundation of what we've built, and what this year's festival is all about. It's one thing to say that we're global, it's another to show that how that translates into local personalized access that's trusted. And that's where our next speaker and my colleague Eric comes in. As a head of North America and a chief of staff, Eric works directly with clients and partners across regions and the globe to ensure Intellect is not just present, but truly relevant in each market and region that you are in. He will take you through how we make global access real, not just numbers on the slide, but care that lands in the right language, culture, and context. Over to you, Eric.
Yeah, thanks, Theo, and thanks to all of you for being here. I'm really excited to talk to you about something that matters, really, I think, to every organization, and that's making mental health support actually global, but also personal and practical at the same time. So I'm going to start with a challenge that I've observed, and it's that really everyone that I speak with, everywhere I go, I hear a lot of the same things from HR leaders, and it's that, I'm quoting, "We know mental health matters, but delivering it is really tough, and the issues tend to fall into 3 buckets. First, on the left-hand side, programs often look global but act regional. They might cover a few big markets, but there's still gaps in languages, time zones, and reach. And second, there's often a cultural disconnect. So a provider who doesn't understand the local norms or realities of employers that can struggle to build trust with their patient, if you will. And third, this leads to unmet expectations. So programs can feel like compliance checkbox, engagement is really low, and employees don't get the support that they actually need. And so for us, that's the gap that we're trying to solve at Intellect. So today we deliver care in 100 countries, more than 120 languages. But what actually sets us apart and what makes our difference our approach quite different is that instead of exclusively relying on regional network partners, we actually build those networks ourselves. These are professionals who live and work in the same communities as your employees. And what that does is it ultimately creates trust. And that's really important because we really take pride in palliative care, irrespective of where people sit in the world. So whether you're a nurse in the Philippines, an engineer in Japan, or a frontline worker in Italy or Spain, you're actually connecting to someone who understands what you have experienced in your life, and it works. What we've seen in the data is that employees are twice as likely to complete their sessions when they're matched with someone who actually speaks their native language and provides culturally relevant care. But for us, it doesn't actually stop with the providers. What we do is we wrap everything with on-the-ground support. And so what that looks like is service teams who are there where your employees are. So we have a regional hub and spoke model. So across LATAM, EMEA, APAC, and so on, we have account managers, customer support managers that are there to support your teams. We also have regional experts who make sure well-being strategies are aligned with your business goals and compliance needs. We have implementation teams who don't, just go away after launch. So we do a lot on the engagement side, the utilization side, almost acting as outsourced L&D or wellness teams for your teams, and making sure that people are aware and actually using our services. And of course, related to that is we do a lot in terms of just making sure that we're localizing that content as well, so that it can be applied across many populations around the world. So you might be wondering next, like, how do we scale this without compromising on quality? So there are 4 things that make it work. Number 1 is we curate every provider. So instead of just aggregating the largest network, every single one of them is vetted by Intellect. We train them, we support them through our clinical excellence team, and we also make sure we're actually adhering to our governance standards. So for example, if they have a session that rates poorly, we make sure that gets escalated to us and we address that immediately. We also deliver consistent standards across standards of care across borders, and that's backed by the framework that's set by our clinical governance team. We also balance quality and value. So what that means is thanks to our lean infrastructure that we built out of Asia Pacific, that actually allows us to make our global expansion a lot more sustainable. One thing that we keep hearing in our conversations is, given the macro environment, cost is a key decision, or rather driver in decisions around EAP or mental health solutions. And so while we're not saying that you're compromising on the quality of care, we just understand that value right now is very important, and we're able to do that through our unique business model. And finally, speed. So on average, employees get matched with support in just over a day. At least from what's publicly available from our peers, that's best in class. And so if you compare that to industry norms of, let's say, 5+ days, and you can actually see the difference that makes. Fewer crises, faster recovery, and better productivity. So the impact is clear, right? For leaders, it's about more than offering a benefit. It's about, 1, compliance with global and local standards. So we adhere to things like ISO 45003, making sure that there's retention, creating safer and more supportive workplaces, performance by reducing absenteeism, and shared success, knowing you don't have to carry the burden alone. Again, what we realize is, or what we've learned through our years of experience working with HR and benefits teams, is that there's a lot on your plates. And so we want to be a partner in helping deliver that change that you're looking for within your employee populations. Because at the end of the day, it's not just about having boots on the ground, it's about making sure that the care is trusted, effective, and scalable. So all in all, just to summarize, that's the foundation that we've built at Intellect. And to take you deeper into how we ensure quality and consistency and through our clinical governance and the smart use of technology, I'm going to hand it over to my colleague, Dr. Oliver, our VP of Clinical. Oliver, over to you.
Thank you so much, Eric. And hi, everyone. Very, very excited to be here with you. So I'm Oliver. I'm the VP of Clinical at Intellect. I wear 2 hats. One is clinical quality, to ensure that our quality, stands very high across services and our product. And the other is research and innovation. And I'm very proud to say that from day 1, Intellect has placed scientific validation at the center of our work. And I will now walk you through how we think about quality at Intellect, and I will then share with you some exciting research studies that we have just completed. So first up, clinical rigor. Now, we look at clinical quality through various lenses, but here are the 4 main pillars. 1 is clinical governance. So we have a very strong in-house clinical operations team that sets our care standards around risk management, escalation flows, and crisis management. We have an in-house clinical excellence team. You just heard Eric share about that we train our supervisors, and we keep very close eyes on the quality ratings of their sessions. We have clinical supervision for our supervisors. And we have an in-house training program, professional development, all to ensure that the quality they deliver is at the highest possible quality. And we have an in-house research team as well that runs various scientific validation studies in partnership with universities to ensure that there is evidence base behind everything we do. And lastly, it's very important that the care you see across markets and across countries, regions is consistent. And we ensure that by owning the provider network and by training every provider in-house. We onboard them, and that also allows us to track clinical outcomes consistently because the providers sit with us on our platform. Okay, we have a very active research pipeline, and I'd like to call out two studies in particular that we have just completed. One is on mental health AI, and this study, excuse me, was done in partnership with the National University of Singapore. And unlike many AI studies you may have seen in the news that focus only on symptom reduction or symptom change, we asked a bigger question here, which was, can our AI agent not only reduce distress, but also proactively improve well-being and resilience? And the short answer is yes. Over the course of just 4 weeks, we've seen significant improvements in positive affect, resilience, and also performance. And there's one more call out here, which I want to quickly make, which is around clinical safeguards. You're probably all familiar with a lot of the tragic stories we heard about how people use ChatGPT or other LLMs as their personal therapist, and that can be very problematic when these LLMs become an echo chamber and agree with everything. We have very strong guardrails here, and one important feature is our crisis system. So whenever a user flags anything remotely related to risk, our in-house 24/7 crisis intervention team gets activated, and they immediately reach out and check in with the user. So there's always a human in the loop here. Secondly, we have just completed our global study. Sorry, go back on the slides. We've just completed our psychosocial risk study. You may be aware that in various parts of the world, legislation is tightening around compliance when it comes to psychosocial hazards. So things like remote work, complexity of work or workload, but also bullying or harassment, and also looking at the resources available in the organization, all have an impact on the burnout risk and mental health issues. So that's very critical. And one question we asked ourselves is, if you are in a global company operating across markets, but you have different legislations to deal with, how do you do that? And we did what we do best at Intellect. Our clinical research team built its own tool, which is compliant with ISO 45003 and all the codes of practices around the world. And so we've come up with a global tool here that can be modularized depending on your local requirements. And you see a snapshot here of the reporting as well. It comes with in-depth reports using intuitive traffic light systems to flag the psychosocial risks and hazards to your organization, and importantly, allows you to track over time against industry benchmarks whether your company is improving on those risks identified by our tool. Okay, next slide. Now, looking forward, we have exciting studies in the pipeline as well. Just to call out two, so we've partnered with Duke NUS on the world's first worksite randomized controlled trial that looks at the efficacy and the cost effectiveness of our AI augmented care system. So we're looking at dollar cost savings via reduced medical claims. We're looking at absenteeism, presenteeism, and productivity. So the question is, does our system work? And we'll put this to third-party validation and through the scientific tests here, really. And secondly, we've just partnered with the University of Pennsylvania, one of the top schools in the US, to co-develop mental health AI tools. And we're specifically interested in bringing down the cost of therapy, which, as you probably know, is very expensive. And we also think there's a lot of room to further improve the clinical care through AI augmenting the care delivered by our providers. Okay, now you may wonder, how do we tie this all together? So at Intellect, we really make sure that the care reaches the people when they actually need it. And we do that with our responsible AI. So in short, as I just said, we never replace humans. We use AI to augment the care our providers deliver. We provide users with instantaneous access around the clock, 24/7, as a sort of first line of support. So if you look for help at 2 a.m. in the morning, you can instantaneously connect with our AI agent. We make sure that care is scalable in that way and that it's safe. And as Theodoric has highlighted in his opening remarks, everything is built in-house with the highest clinical safeguards. I will now show you a very quick video to give you a glimpse of what AI looks like at Intellect. So here you see Intellect Guardian supporting users. They get instantaneous access. Intellect Cruise is built to empower, enable our providers so they spend less time on administrative work. They get support on diagnosis and treatment planning. And lastly, you see Intellect Vault, that's built for HRs, gives you a wealth of insights, and you can query the data if you don't know where to start. Okay, and back to Theo.
Thank you very much, Oliver. And all that you have heard in the last 20 minutes is exactly what we heard today. Technology, clinical excellence, a global and localized network. All of these things matter, but on their own, they're not enough. So whether you're supporting a team of 50 or 100,000 people or more, you're part of a much larger movement on this festival and beyond. We're on a movement that ensures an aim to build care that lasts and care that truly matters beyond what we do today. So at Intellect, our mission remains unchanged to impact global and diverse workforces one life at a time. But the truth is, we cannot do it alone. We can only succeed if we build this together with all of our clients, our partners, and all of the listeners and attendees tuning in, who push boundaries, with clinicians who deliver care, and with communities who trust us to show up in meaningful ways. So my call to you as we wrap up this opening session, before we dive into the festival formally, is a very simple, clear ask. As you go through today's sessions, listen, share, but also process and challenge what you are listening, and also imagine what could be as well. Let's not just talk about what matters, let's build it together. One of the things that we think about a lot at Intellect is that, yes, the awareness and the attention has grown a lot in mental health care, but the job and the work to be done is far from over. So I'm really excited that you're here once again. I'm really looking forward to enjoy all these sessions we've got for day 2 of the festival, and we hope you have a good time. Over back to Aisha.
Awesome. Thank you, Theodoric, Oliver, and Eric for such an inspiring message to kick us off for this segment. Now, I hope you're all amped up for our first session of the day, Beyond the Buzzwords, What Real Mental Health Impact Looks Like. And to join us, you can do so by returning to the Zoom events lobby and clicking the Join Now button beside the session title. We've also dropped the link in the chat on the right-hand side for easier access. So just to repeat, please head back to the Zoom events lobby page and click the Join Now button beside the next session's title. All right, see you there.